By 9 a.m., Joseph Chikomeko had reached Naguru China Friendship Hospital to access services. It was not until 7 hours later that he got rescue. He says urgent intervention by government is required. At Mulago National Referral Hospital, the struggles to access service have been deep, says Director of the hospital, Dr. Rosemary Byanyima.
We already made a hospital round and all the wards are covered. Ward rounds were going on because these are patients who are already in our custody, being taken care of. The emergency units are busy attending to all the emergencies and all the referrals.
Byanyima has urged medics to act ethically.
As a guiding principle, as health workers, even when we say that the health workers have put down their tools, they don't cease to care for those who are already in their hands, as well as the emergencies.
Maibo Kukunda, Head of Department Advocacy and Networking at Uganda National Health Users and Consumer Organization, instead puts the ethical question on Medical Workers Association.
We actually would expect the association, the Uganda Medical Association and different associations to be the ones working and maybe be listened to than health workers going out of the hospitals.
Area leaders today rushed to health centers to rescue the ailing situation. Ronald Balimwezo, MP for Nakawa East, made a visit to Naguru China Friendship Hospital. Balimwezo asks the Ministry of Finance to implement the President's directive.
Leaders, we have been paid and we get paid enough money. But I don't know why they don't want to pay people who are basically very necessary and that actually help us to build our economy. Because if we have a diseased community, it is unproductive. And therefore, for us to build our economy, we must have healthy people. And the healthy community is basically handled by these doctors. That's the reason that I want to request government to clear these people. Minister of Finance should, as a matter of urgency, clear these people so that they can execute their works with happiness.
He lauded a handful of health workers attending to emergencies.
Actually, I thought it was worse, but I want to appreciate the director and the doctors of Naguru, because at least there is skeleton staff to handle the emergencies. And they are doing the work. I want to appreciate them.
Mayor Kampala Central Salim Uhuru Nsubuga was at Kisenyi Health Center 4 to digest the situation. He says government can end the impasse.
The government of the NRM is kindly let us speed up the process whereby we can give them what belongs to Caesar, because to be honest, they've, during the COVID time, they've sacrificed their lives towards that. And if you see here, the population is too much, and let us give them, if we can give politicians such kind of money, why not the doctors who have offered their lives? So I stand by them.
Kukunda takes a similar view.
Minister of Finance to have come out at least to act on the presidential directive in his last speech. But we have not had anything as regards to that. And we call upon a civil society, we call upon government, specifically Minister of Finance, to put into action this very directive, because it is urgent, it is security, as we see security, to avoid many people from dying.
Ministry of Health spokesperson Emmanuel Ainebyona has given assurance to medical workers the queries will be resolved.
Yes, we appeal to the medical doctors to be patient since government is handling their issues. These are not new issues. They have been known to us, and government working through its various agencies and structures is handling their issues they raised.
A total of more than 1,850 health workers in various public health facilities announced industrial action that started at midnight. The medics demand rise in remuneration, improvement in welfare. The participants include doctors, nurses, midwives, consultants, medical interns, and pharmacists. The medics on August 6th sent notice to government demanding to meet their demands. Lucky Atari Binjira, Shamim Natebwa, CTV, PM Edition.
Forever! Solidarity! Forever!